Drug overdose is a leading cause of death in New York City and kills more New Yorkers each year than homicide, suicide, and motor vehicle crashes combined. Opioids are involved in most overdose deaths. Opioids include heroin, prescription painkillers, and fentanyl. Fentanyl is a fast-acting and highly potent opioid that is being found in heroin, cocaine, crack, counterfeit pills, and other drugs sold on the street and online. An opioid overdose happens when someone takes more or stronger opioids than their body can manage, causing their breathing to slow down or even stop. Naloxone, also known as Narcan, the brand name for naloxone nasal spray, is a safe medication that can temporarily reverse the effects of an opioid overdose. Some signs of a possible opioid overdose include unresponsiveness, slower or stopped breathing, lips or fingernails turning blue, gray, or white depending on skin tone, snoring or gurgling sounds. In some cases, people may become rigid or stiff. If any of these symptoms are present, it's important to respond quickly. If you're worried someone might be overdosing, first check for responsiveness. Shout in the person's ear. If the person does not respond, do a sternal rub by making a fist and rubbing your knuckles hard on the person's sternum or breastbone for about 5 to 10 seconds. If the person responds to the sternal rub, which could include speaking or moving, continue to monitor them and keep naloxone on hand in case they become unresponsive. The person should not be left alone. If a pulse oximeter is available, it can be used to monitor their oxygen levels if they appear sedated. If they don't respond, it's an emergency. Call 911 or alert a medical professional if there is one on site. It's important to have medical help on the way. There may be complications, or the person might be having a different kind of medical emergency. When calling 911, give the dispatcher a specific location and tell them you are with someone who is unresponsive and not breathing. With some exceptions, the New York State 911 Good Samaritan law provides protection to a person calling 911 to save a life and to the person who is overdosing, even if drugs are present. As soon as possible, give naloxone. This video provides instruction for the single-step nasal spray called Narcan. Peel back the package to remove the device. Place the nozzle in either nostril until your fingers touch the bottom of the person's nose. Press the plunger firmly to release the entire dose into the person's nose. It's important not to press the plunger until the nozzle is in the person's nose. Each device can only be used once. After giving naloxone, monitor the person for 2 minutes, and if the person isn't breathing, give rescue breaths while waiting for the person to respond. If the person is not responsive after 2 minutes, give a second dose of naloxone. You can perform rescue breathing or CPR if you know how. To perform rescue breathing, place the person onto their back, tilt their head back, and open their mouth. You can place the face shield included in your kit over their nose and mouth. Then, pinch the person's nose closed, make a seal between your mouth and theirs, and give 2 regular breaths into the mouth. Ensure that their chest is rising, and readjust the person if necessary. Continue with 1 breath every 5 seconds. Getting oxygen to an overdosing person might reduce serious complications and can keep a person alive until help arrives. When not giving naloxone or rescue breaths, put the person on their side to prevent choking. This is called the recovery position. This is particularly important if you have to leave the person alone. Hopefully, after 1 or 2 doses of Narcan, the person will respond. If this happens, calmly explain that they were overdosing and you gave them naloxone. Naloxone works for 30 to 90 minutes. Explain to the person who overdosed that they may experience opioid withdrawal symptoms until the naloxone wears off, and that using more drugs is unlikely to relieve withdrawal, but could increase risk for another overdose. Medical attention after an overdose is important, but if the person doesn't choose to get medical help, they should not be left alone for several hours, since another overdose is possible when the naloxone wears off. To review, if you see someone who you think might be overdosing, first, check for responsiveness, shout at them, and do the sternal rub. If they don't respond, call 911 so that medical help is on the way. Give Narcan. If the person doesn't respond within 2 minutes, give a second dose. Remember, it's also important to give rescue breaths and put the person in the recovery position. If you use drugs, follow these safety tips to reduce risk of overdose. Test your drugs using fentanyl test strips. If positive, consider not using. If you do plan to use, start with a small dose and go slowly. Avoid using alone and take turns. Avoid mixing drugs. Keep naloxone ready and on hand. You can review overdose response steps, learn about overdose prevention, find naloxone, or submit an anonymous report if you use your naloxone by downloading the Stop OD NYC app, available in both the iPhone and Android app stores. By following the response steps outlined in this video, you can save a life.